Welcome back. Amid all of the troubling events in the world and right here at home, here's one you might not have heard of. America's hospital system is in crisis. That's the message of a new movie coming out tonight on Epic TV.
Their motto is "We care." They don't care.
He died in the ambulance.
Yes.
Almost 200 hospitals in America have closed in just the last few years.
You die. That's exactly what happened.
911, what's your emergency?
Hospitals have long been a place of confidence and trust.
I'll go back this far. Politics killed the hospital.
But what happens when hospitals across America close their doors?
All the good providers, the surgeons and so on, left.
It's a death in the community. Having two hospitals and all of a sudden having none.
Very scary. We're in a crisis here, aren't we?
Without question, we're at a crisis point.
NTD Business's Don Ma spoke with the host of the documentary, Steve Gruber, for more insights. Take a look.
And with me here is Steve Gruber, director and host of the new documentary on the Epoch Times, Flatline, America's Hospital Crisis. Now, Steve, this is a very fascinating topic. I think it doesn't get enough coverage. Let me just ask you, what is this hospital crisis that America is facing?
Well, and you're right, it doesn't get enough conversation at all because most people remain, well, fairly unaware that this is happening. But let me give you some background here. Over the last 15 or 20 years, about 200 hospitals in America have closed their doors permanently, many of those in rural areas, but not all of them. Currently today, according to the National Rural Healthcare Association, more than 600 hospitals in America are in financial trouble. 200 of those are in acute trouble. They could close today. And people don't think about the hospital. They don't. I mean, when do you think about a hospital if you don't work there? You don't until you need it. And these hospitals are going dark for a variety of reasons. They're going dark in all sorts of places. In the documentary, we traveled to Massillon, Ohio, a city of about 300,000. It actually lost 2 hospitals in 10 years' time. Now doesn't have one. We go to Kennett, Missouri. That's a town of about 10 or 11,000 people. Its hospital closed 5 years ago. And then we go to Ducktown, Tennessee, a town that's as small as it sounds. It served an area, a regional hospital it was, serving several counties, a smaller area. But all of these places have lost hospitals, so people lose access to health care. The jobs disappear along with it, which is devastating to the community as far as its economy goes as well. And these are happening all over the country. Plus, something else we learned along the way, ambulance services also going bankrupt across America. Just last year in the state of New York, a dozen different ambulance services went bankrupt. These are problems that people don't realize are happening to them, to their community, to their country until it hits them right in the face.
Now, Steve, personally, I don't use the word crisis lightly. So when you put this word in the title of your documentary, you're not just being sensational, are you? This is really how you would describe the situation.
Well, let's take and just bring crisis down to a personal crisis. Let's say it's you or somebody you care about. They're having a heart attack. They've been in a car accident. The hospital that's been there your whole life is suddenly closed. So the next emergency room is not just 5 minutes away. It's 45 minutes away, maybe farther. Is it a crisis now? In fact, during the documentary, we talked to a woman in Kennett, Missouri. Her husband had a heart attack 1 year before the local hospital closed. He was taken to the local hospital. He spent a couple of days there. He was fine. 1 year after the hospital closed, he had a similar heart attack. Not necessarily a life-threatening heart attack, but a heart condition, obviously. He died in the ambulance because the next hospital down the road was almost an hour away. The other part of this that people don't think about, diagnostics is a big part of what keeps hospitals going, be it mammograms or colonoscopies. These are the lifeblood financially of the hospitals. Well, people will go 5 minutes to their local hospital, get those tests done, but suddenly the hospital's 45 minutes or an hour away. And they say, you know what, I don't want to take a day off from work. I don't want to take all that time, spend half a day, drive over there, sit in the waiting room. So these diagnostics are not being done. So diabetes, cancer, heart disease, other issues are being missed. What does that cause? It causes people to die as well. So whether it's an acute problem like a heart attack or a long-term problem like scanning for cancer or other chronic illnesses, these things are not happening, and it's happening more and more because hospitals across America are closing. I think crisis is exactly the right word.
And Steve, how do we get here to this point?
Well, there's a lot of factors here, to be fair. In the 1980s and 90s, for example, reimbursement CMS is the arm of the government that reimburses hospitals when people go in and they're on Medicare or Medicaid, they're on Social Security, wherever the money may be flowing from. Back in the 80s and 90s, the reimbursement rates were quite reasonable. Didn't take a lot of time to get the money back from the government, usually less than 30 days. Now, you go to any hospital of any size in America, they'll have a whole department dedicated just to getting the money back from the government that is owed to them. So that's a problem. And by the way, the reimbursement rates have gotten smaller. For example, in Ducktown, Tennessee, the mayor there told us that the reimbursement rate to having an indigent person walk through the door of the emergency room was $15. $15. He said he couldn't pay a nurse for 15 minutes for $15. So there's one problem. Secondly, you've got these big corporations, these healthcare corporations that buy groups of hospitals and decide which ones get to stay open and which ones they close. Then, of course, you've got the entanglement of insurance companies and other factors all playing in. There's not one thing to blame here. There are several factors to blame. But in the end, what happens is people lose health care. Communities lose health care and jobs, and oftentimes their identity, because that hospital is oftentimes the foundation where babies are born and people go when they themselves hurt, they skin their knee, they need stitches, whatever it may be. It's also a place where older people, elderly people go to die with dignity in their community. That identity is ripped away.
And Steve, let me ask you a few questions about the film itself as well. So when you were producing this documentary, what did you discover that shocked you the most, would you say?
I think one of the most surprising things was the vanishing ambulance services. You see, in order to be certified, at least where I live and in most states, I don't know all the rules, but to be certified as an ambulance service, you have to have EMTs on staff 24 hours a day. Well, there's a lack of EMTs available in America. There's a crisis in that regard as well, because there's not enough people to get in the ambulance to come help you if you're having a heart attack. So a lot of these ambulance services are shutting down. They're also not getting the reimbursement from the government the same as the hospitals. It's putting them out of business. So, for example, in New York, like I said, a dozen ambulance services went out of business last year. Here where I live, just south of where I live, an ambulance service went out of business at the end of last year as well. Now, another company came in and said, we'll cover the territory. But they took away any guidelines or specifics as to what that meant. So here's what it means in practical application. If I'm having a heart attack 20 minutes south of where I'm sitting, half an hour from the hospital, you can call an ambulance if you're having a heart attack. And it will come, but it could be 20 minutes or 30 minutes. Do you have that kind of time when there's a heart attack occurring or there's been a car accident? The answer is no. You don't have that kind of time. They've covered the region, technically. But in practical application, it's dangerous because we're being spread thinner and thinner and thinner in the ambulance services, in the hospitals. And I think that's what shocked me the most, how many ambulance services have just vanished because of a lot of that's bad policy from the government.
And just one final question for you, Steve. What would you say that after viewers watching this film, what is the biggest thing they will take away from it?
Awareness. People need to know this is going on. So the number one thing I want people to get out of this is to find out about the hospitals in their area. Are they in good shape? Can they make it? Will they make it? Will they be here a year from now or 10 years from now? Awareness is key.
All right, Steve Gruber, host of Flatline, America's Hospital Crisis. Thank you.
Thank you.
To watch or learn more about Steve's fascinating documentary, visit flatlinefilm.com. This Epic original documentary premieres on Epic TV tonight at 8:30 p.m. Eastern.